Our next speaker is Dr. P.C. Mahapatra. Dr. Mahapatra, he doesn't need any introduction actually. Everybody knows him. He has been ex-professor, OBGYN, SCB Medical College, Cuttack, and has been a president Foxy 2011. And the topic of today is de-stressing patients and professionals. I think Dr. Mahapatra, just talking with you only we can de-stress ourselves. You have such a good personality, I would say. Really commending. So let's enjoy his talk today.
Riva chairpersons, my lovable doyen of gynecologists and obstetricians and fertility specialists coming to this place for ISAR 2024. And my personal behalf, I have a hearty welcome to all of you to Orissa. Enjoy the place, the serenity, and enjoy the environment and the academics for that. Well, I was supposed to listen. I told Sujata that don't give me any talk for that, but Sujata forced me that you have to say something. I told, what are the topic you want me? She told that you speak about sense, nonsense, whatever it may be, but you have to speak for that. For last so many years in ISAR conference, I always speak on infertility subject. So this time I thought I'll have an out-of-box topic related to the stress, both for the stress of the fertility specialist as well as our beneficiaries, our patients for that. That could be a sense or nonsense, you must judge it. The idea came when 8 years back, my sister Santa, in one of the all Telangana conference, gave me a topic on stress and obstetricians and gynecologists. I thought this is a forum where I will extend it to infertility practice for that. And that is the genesis of my talk today. I bring greetings from the place of Lord Jagannath. Well, I divide my talk into three main aspects. First, I will speak on something related to stress for the professional. Second is related to the infertility practitioners and infertility practice. And third, how we can be happy, practicing infertility, happiness for everybody. But this is important because we know that the purpose of life may be by everybody, professional, non-professional, any human being, is to make yourself happy or to make others happy or both happy. I think you target for both should be happy. If a fertility specialist is happy and infertility, our patients are happy, then the purpose of life, our life is solved for that. Stress is the spice of life. There are two types of stress. Eustress, good kind of stress, and distress, nasty kind of stress. And we divide into positive stress and negative stress. I'm a person who always invites stress. But because I believe that no stress, no growth, no starvation, no growth. But you have to define and decide what is a positive stress. Positive stress is a challenge to your life. Negative stress is a threat to your life. Definition of stress. Defining stress is not easy. Professionals like us who spent most of their lives in stress still have trouble of defining the term. Defining stress is much like defining happiness. Everyone knows what it is, but no one agree on a single definition for that. But the Webster Dictionary says that stress describes a condition where an environmental demand exceeds the natural regulatory capacity of an organism. But these are some of the hard facts in the current scenario. We live in the age when we have forgotten that life is all about. We can easily put a person on the moon, but we have trouble walking across the street to meet a new neighbor. We can fire a missile across the world with pinpoint accuracy, but we have trouble keeping a date with our children to go to the library. We have email, fax machine, digital smartphones so that we can stay connected, and yet we live in a time where human beings have never been less connected. We deprive of connection. I remember Swami Vivekananda term, connect and connection. In this era after this 2020 COVID era and all that, we have very good connect, but connection is lacking for that. We have lost touch with our humanity. We have lost touch with our purpose. We have lost sight of the things that matter most. Now, origin of this stress. Hans Seil, an Australian-born endocrinologist, came up with the word stress to to describe a physiological and emotional response, and therefore he was designated as father of stress. He borrowed the word from the field of physics and engineering, where the words stress and strain were in common use. Later, he realized that strain would have been more appropriate, but by the time it is locked, and therefore he used the term stress. ABC of stress: A is activating agent, B beliefs and perceptions, C is consequences, emotional, physical, and behavioral. How to manage stress? Managing your stressors is identify the stressor. There are two types of stressor. One is a potential stressor and one is a modified stressor. Potential stressor, nobody can change it, but modified stressor, one has to change for that. Changing your thoughts and perceptions, managing the stress response for that. Now, evolving changes and role of clinicians, you have to divide into patient profile, public profile, provider profile, process profile. All are modifiable sensors, processors for that, and augmenters for that. Patient profile, you know, everybody is practicing education, awareness of the patient, category of patient, expectation of the patient, from prescriptive to participative to directive practice. People will say that you do. Earlier, when people will say that prescribe, whatever I prescribe, I say that you require ovulation induction or IUI, you require IVF. Now it has come to participatory practice. Then say that yes, you participate, you discuss with the patient what is to be best for that. Now directive practice, people will directly come and say that I need IVF for that also. So that is the thing which is changed. Quick heal and no problem, only pleasure, no pain, changing society, changing concept, you have to adjust with this. Public profile awareness is there, attitude toward the profession, role of media, legal perception, undue expectation, all of you, day in and day out, you know that. Provider profile, our own will and skill should be there. Attitude and aptitude should be changed. Acquiring a knowledge, acquiring a skill. Not only technical skill, but non-technical skill is also important for that. We gather here for acquiring a non-technical skill, but non-technical skill is more important or equally important than the technical skill. Role of mentors are there, introspection and learning attitude, and last but not the least, for happiness, you need a balance between a professional and personal life for that. That's a different chapter by itself, and this you have to acquire, that you have a life, personal life, you have to balance these two. Process profile, you need a congenial working environment, a system simplification, policies of programs for women's health are there, role of ancillary personnel are there. So the management deals with the focused areas. I will just give an insight of that. Personal, you have to change your attitude and aptitude. Professional, will and skill, work versus life, pain versus pleasure. Environmental, workplace, health system, team and tool, ancillary. All these are modifiable. You can change it if according to your own design and setup for that. Beneficiaries also, there are various types of beneficiaries. It's difficult to change. Type, risk assessment and referral. And of course, the general management of meditation, yoga, spiritual. I'm not a Baba to speak about it. Relaxation weekend. People say that you go in for day practice for 20 days, 10 days relaxation. But after 10 days again you come back, it is not going to again go for long years for that also. That is not a permanent solution for that. And introspection. Now coming to the infertility, infertile couple, what are the stress factors? Relationship. Now in the current era, this is really a factor for that. No relations, no emotions, no bondage is there for that. Just 2 months back, I was in Mumbai airport, sitting there. Two handsome boy and beautiful girl stood behind and sat beside me, and they were chatting. And I saw all in the mobile. The person was chatting, the lady was also chatting. I don't know who they're chatting. Then after half an hour, they asked me, "Where are you going?" I told them. When they know that I'm a professor, retired professor of gynecology, they become cheered up. "Sir, we are husband and wife, and we are infertile for the last 1 year. We are married for 10 years, and trying period is 1 year. By the time it is 35 years for that. And we have moved." So they showed the prescriptions and all that. I told, is the person you are chatting with whom? "Now with each other." I told, you are sitting beside, the person was chatting, the husband was chatting with the wife and wife was chatting with the wife. You don't touch each other, you don't talk each other, you have no relationship. And better, you have an imaginary baby in the mobile and see that this is our baby for that. So this is the changing situation, relationship has changed. And if at all there is a relationship, every time there is a quarrel between these. They don't have a time to speak about it. Many patients who come forward, the girls, they're not married. They decide that I don't want to marry. I found out there are two factors for which they don't want to marry. Their fathers and marry, every day they quarrel each other. There is the mind that yes, I won't marry. Or they see their peer groups that love at first sight, divorce at first night. So that is the sequence for that. And that's why this is the situation relationship is very important. Occupation. Again, many people, I see many of the patients who are in IT, double income, quadruple problem is there. And they see in Bangalore, Hyderabad, you see the type of work and all that, and how this occupation is influencing that. Sexual dysfunction, I found out 15% of the patients of infertility, they have a sexual dysfunction for that. So therefore, the patient's profile is important. Apart from it, the familial and social factor, in-laws and outlaws, they create a lot of problem for that also. Impact of internet, Google, doctor and social media, everybody knows for that. And by the time they reach you, they are full with all knowledges regarding infertility and all that for that. They will guide you, they will direct you to tell this and that. There are myths and realities for that. Then treatment induced. This is a very important thing, treatment induced. The frequency of visits. How many cycles, my dear? Cycle after cycle. And frequency of visits from a long distance is a factor, and this is a practical situation for that. And how to reduce the frequency of visits, that should be considered by the professional like you. Timing also is important. Cost is an important factor, and mechanical rather than emotional. Sex has become a mechanical. Now you see a follicular study, yes, this is 10 millimeter, 12 millimeter, balloon फट जाएगा, अभी intercourse करना है. So then, absolutely male sexual dysfunction, gone. So that is the situation, and you have to counsel for that. Failure, professional attitudes should be there. These are all stress induced. How to distress the patients? Counseling. And a counselor, therefore, all the ICMR rules are, even the infertility specialist, the documentation of the guidelines of counselor is a must for that. But counselor should be targeted for counseling in regards to the infertility. Referral. Whom to refer, how to refer, and who to refer. That's a very important thing. Referral, you find a suitable persons where you find result for that. So decreasing the frequency of visits, decreasing the cost. And I asked the pharma people and the researcher to find out newer molecules, medications. And the worst is that the injections. I remember Jaydeep's slide of injections with the baby and all that. How many injections is there? Still is in my mind for that. So that's a very painful area for that. So I asked the pharma people, abolish the injections for infertility practice. Find out some oral gonadotropins, oral stimulation protocol, and that will solve many of the purpose for that. If at all injection is to be there, give weekly or fortnightly one. That should be the target for that. And that is going to happen. This is a dream. I am telling absurd, fanatic idea, but that will come soon for that. Medication, newer molecules should come out. Insurance, national insurance, organized insurance. I think that now there has been part of the insurance companies who have come up with that. Social taboos, optimizing results is the main thing. Ultimately, the results matter for that. Optimizing results and minimizing complication. And till we get something called distressing capsule or happiness molecule. You take one capsule, you become happy for that. We're waiting for this in the next dream. Lifestyle modification, enhancing conjugal and emotional life. That's important. Primarily, I've seen the changes in the personal life for that. Change in the conjugal and emotional life is important. And therefore, people go for babas to mamas, from pati to pati, from Tirupati to Pasupati, they travel for getting, but that's a temporary thing for that. Professional stress factors, fertility specialist versus general gynecologist. I find now the number of fertility specialists is gradually increasing. Many of my students are doing this fellowship program and engaged in that. After 10 years, they repent. Why you have entered, sir? Sir, we have done a wrong thing for that. Some of these. I think I told my students that yes, if you are totally dedicated for that and you decide that whole of the life will spend on that, engage in that, either infertility, oncology, or whatever it may be. Otherwise, you will suffer. Dedication, commitment is very, very important in all medical professionals, but more so in infertility. This is the first and foremost part for that. And patient profile, you know, practice profile, you know. The practice profile is also changing in infertility. From single, earlier we have a single, now group, chain, and it is from I think, helping patients to from charity to commercialization for that. From health service to health industry, it has come up for that. So professional stress, technical stress, optimizing results, minimizing complications. Coping with failures. I have seen many of the infertility specialists. After that, they suffer from cardiac. I've seen many of them infertility, my colleagues and all that, they suffer from that. This is because of the stress for that, coping with failures. Regulations has become a great it's a boon also, and it's also a ban also. It has to be considered for that. Some of the changes has to be there for that. Regulations is adding stress to our life for practice for that. Ethics also is one of the important factor. Non-technical stress, those who have a chain of hospitals, how the units will run. Running the units will become a great burden for that. And coping with the team, marketing is another. Marketing has become a common thing for the in for the practice for that. Competition and comparison is another factor for that. That adds to the stress. So how to distress the professionals? Subspecial and super specialty attitude. The dedication should be there. Enjoy the work-life balance is there. You have to change your mindset for that. Optimizing results, minimizing complications is the sole thing. Minimizing cost, upgrading your knowledge and skill, defining the limits, adherence to ethics, ambience of fertility units. Working with pleasure rather than working with pressure. And enjoy the success and tackle the failures. That should be the motto for infertility specialists. Otherwise, you are deprived of that. Now the last part, happiness. How to enjoy the happiness, how to have it. And go to this place. Does they give happiness for that? You give sermons for that. This is one area. Happiness, everybody's birthright. Swallow a pill, get happy. Do yoga, find your bliss. Hire a life coach, regain your self-esteem for that. So happiness and living. You have an art of living, you have a science of living, and you have a commerce of living. Combine all this, then only you can have a happiness for that. There was an old tad had been sitting on the edge of the river for some hours without getting a bite. The combination of several bottles of beer and a hot sun caused him to nod off, and he was completely unprepared when a lively fish got himself hooked, tugged at his time, and woke him up. He was cut completely off balance, and before he could recover, found himself in the river. A small boy had been watching the proceedings with interest. As the man struggled to get out of water, he turned to his father and asked, "Dad, is that man catching a fish or is that fish catching a man?" Whenever you see money, power, prestige, you are no longer yourself. You lose your happiness and joy for that. Man needs three things for happiness. They need three things. Whoever may be, professional, extra professional, whatever it may be in a life. He needs money, energy, and time. These three things, if one gets it, one is happy for that. But God has given a paradox. Paradox of life in three phases. Just balance. In first phase of life, you have energy, you have time, no money. In middle phase, you have energy, you have money, no time. And the last phase, you have money, you have time, no energy for that. You have to balance all these if you want to be happy for that. And whatever may be the professional. So these are five senses root of misery. Home, hospital, stress, time, external factors like public, press, politicians. These three are create a lot of pressures for that. And life, risk and stress. Life is nothing more than a game of numbers. The more risk you take, the more rewards you will receive. Fortune is not on the side of the point-hearted. Take more risk, no gain. See your troubles are blessings, and then remember that there are no failures in life, only results. There are no true tragedies, only lessons. There are no problems, only opportunities waiting to be recognized as solutions for that. Thank you very much, ladies and gentlemen, for giving me this opportunity.
Wow, what a great presentation, sir. Wow, beautifully you have expressed the thoughts. I think everyone in the hall has touched their hearts. Sir, I want to add here that since we are both from Haryana, in Haryana there is a drive is on, and every city has been covered. There is a workshop for the doctors, and they are being taught how to involve Gita, role of Gita in the practice, role of Gita in the doctor's life, and then there is a special workshops for the patients also. So this drive is being carried on in the Haryana, and thank you so much for such a nice presentation.
Is the government sponsoring for that?
No. Government is
but
not.
But in Odisha, the government is sponsoring doctors to go to two centers, the Ravi Shankar and Aisa, the Sadhguru.
Okay.
For training, government is giving full airfare, stay, everything for 10 days
Oh,
to relieve the
fantastic.
stress.
Actually,
To relieve the stress.
No, actually, there is no. In every city, there is a workshop so that that city doctors can come for 2 to 3 hours, and they can attend that workshop and how to involve the Gita in their life. That is
I
the
think you
motto.
should give a proposal to ISAR governing body and general body meetings to decide ISAR how we can help it for that in that regard. Thank you.
Maybe some NGOs can take over and help the patients as well as the doctors.